Now that you have undergone the stress test and some abnormalities have been identified, we are going to schedule you for a diagnostic catheterization procedure for tomorrow. Catheterization is a minimally invasive surgery, meaning that there will only be a small incision site near your groin or arm, and you should be able to resume your normal daily activities within a day or two. This procedure is purely diagnostic, however, and if we do find any indications of clotting in the heart arteries, then we can take care of it while we are there and will last under 1 hour. The test is used to identify other problems too, such as heart valve problems, overall health function, and other abnormalities, and is performed under a cardiologist and monitors blood pressure and heart function. During the procedure, a long, thin plastic tube called a catheter is placed from the incision site to the heart arteries, where a dye called contrast is injected and X-ray pictures are taken of the heart. The procedure is relatively painless since there are no nerve endings in the blood vessels, and an anesthetic is injected in the skin before catheterization placement. After midnight tonight, do not eat or drink anything, and be sure to get plenty of rest and water. Take medicine as normal, except for any blood thinners or antiplatelets like aspirin or ibuprofen. Tomorrow, when you come into the cardiac catheterization lab, you will lie on a table under an X-ray with a television screen. Small pads will be placed on your chest to monitor heart rhythms, and additional IV can be used to help you relax during the procedure. If the X-rays detect a blockage, an angioplasty will be performed, which means a stent, which is a metal coil, will be placed over a balloon and inserted over the catheter already placed in the artery. Inflation of the balloon pushes the blockage to compress along the artery and opens the artery to allow blood flow to pass. The stent is then pushed on top of the blockage to allow the artery to remain open and not to collapse. If angioplasty is performed, there is a small chance of the artery collapsing, and this could lead to a heart attack, but cardiac surgeons will be prepared if that occurs and immediately perform a bypass surgery. Angioplasty will require you to stay at the hospital overnight with discharge to home in the morning. After your cardiac catheter procedure, the catheter is removed and pressure is applied to the incision site immediately, and a sandbag is placed on it for 4 to 6 hours to ensure that the artery seals properly. From there, you can get up and walk around, and if you feel okay, you will be discharged to go home, and treatment options will be discussed. You will need someone to drive you home after surgery. Once you are home, you should rest on the first day, except to use the bathroom and return to your normal routine the next day, and the bandage can then be removed. Do not lift anything greater than 20 pounds or exercise for 2 days or drive. If you experience any of the following problems, please call us immediately: numbness or severe pain in the arm or leg, bleeding or redness at the catheter site, fever, hives or swollen lips or tongue, shaking, sweats or chills, shortness of breath or chest pain, or difficult voiding or blood in the urine. The risks involved in cardiac catheterization are bruising, bleeding, heart attack and stroke, damage to the artery where the catheter was inserted, irregular heart rhythms, allergic reactions to the dye or medication, tearing of the tissue, kidney damage, infection, and blood clots. Overall, cardiac cath labs are performed very often, and the cardiologists are very skilled and experienced. The risks of the procedure are low, and recovery time is short. Can't wait to see you tomorrow.